Welcome to our speakers and to our audience, whenever you're watching this, to the latest discussion in the Women's Interfaith Network Time to Talk series, Time to Talk Cost of Living Crisis, coinciding with World Day of Social Justice. In this video, we'll be talking about the current cost of living crisis affecting people across the UK and beyond, how women are particularly vulnerable to these economic pressures, and how this fits into a broader picture of financial inequality. I'm Maeve Carlin, the Projects and Communication Officer at the Women's Interfaith Network, a women's charity for all faiths and none, with grassroots groups across London and the South East. The cost of living crisis is leaving people across the UK and beyond struggling to make ends meet, as prices rise across the board, from energy and housing costs to food and basic household items. With inflation at a 40-year high, 93% of adults are reporting increases in their daily expenses from the previous year, according to data from the Office of National Statistics. This crisis comes on the back of years of austerity and a devastating global pandemic. The number of people in Britain relying on food banks rose every year between 2008 and 2021, with 2.17 million food bank users in 2021 to 2022, according to Statista. Although the impact of rising inflation has been felt nationally, it has by no means been felt equally. The Guardian reports that while 58% of those in most deprived regions of the UK have been cutting back on essentials, only a third of those in affluent areas have been forced to do the same. Their article quotes the Governor of the Bank of England, Andrew Bailey, who noted that the current crisis is particularly serious for lower income households, whose spending concentrates on the essentials of living, the very items most impacted by current inflation. However, both in the UK and worldwide, it is women who bear the brunt of economic crises and who are most vulnerable to poverty. Women are broadly overrepresented in low-paid roles and are much more likely to be forced to leave their jobs due to unpaid caring responsibilities. Oxfam report that globally, over 75% of women in developing regions are in the informal economy, many in precarious roles and without legal protections. Data from UN Women, UNDP, and the Pardee Centre for International Futures predicted that by the end of 2022, 388 million women and girls would be in extreme poverty, as opposed to 372 million men and boys. That's a difference of 16 million. In the UK, according to the Women's Budget Group, who we're thrilled to have with us on our panel, the design of the welfare system disadvantages women claimants, who are less likely to be eligible for national insurance benefits due to periods away from formal employment. Cuts and chronic lack of investment in welfare, childcare, and social care sectors also disproportionately impact women, particularly those from minoritized or vulnerable groups. It is, of course, critical to recognise that women with intersecting identities, particularly women of colour and disabled women, are especially vulnerable to poverty and financial pressures. While both groups experience higher rates of poverty, exacerbated by discrimination in the labour market, disparities widen during times of crisis, as they did during the pandemic, and any conversation about the cost of living must tell these women's stories. All these factors leave women particularly at risk during the current cost of living crisis and forced to make difficult choices to take care of themselves and their families, with mothers foregoing food for themselves to provide for their children, even staying in abusive relationships due to worries around housing costs, or unable to access the care they need as older adults. Gender roles that give women the lion's share of caring responsibilities, labour that is not only unpaid but enormously undervalued, represent a massive financial burden, as well as perpetuating financial insecurity. In this discussion, our panellists, who are working on the front lines of these issues, will share their insights, and we will explore what we in the women's sector and faith-based spaces can do to support women struggling with the current crisis and to work for a fairer, more equal system. I'm now very excited to be able to introduce our panellists. Danni Malone is Director of Network Programmes and Innovation at the Trussell Trust, leading her team in supporting food banks to develop local strategies and activities that seek to end the need for food banks in their area. Having worked, volunteered, and been a trustee in the charity sector at a local and national level for over 15 years, Danni is passionate about social justice and has gained a wide variety of experience and skills in the areas of charity leadership, operations, and strategy planning. Ignacia Pinto is the Research and Policy Officer at the Women's Budget Group, an independent network of leading academic researchers and policy experts that analyse the gendered impact of economic policy on different groups of women and men, and promotes alternative policies for a gender equal economy. She's an economist and holds a Master's of Public Administration from the London School of Economics and Political Science. At the Women's Budget Group, she has worked on analysing the impact of the cost of living crisis on women and the recent government's announcements on that topic. We'll now hear short presentations from our speakers.
Hi, my name's Danni. I'm Director of Network Programmes and Innovation at the Trussell Trust, and my role oversees supporting our food banks as they seek to deliver their strategy to end the need for their services in their communities. But for people who don't know, the Trussell Trust, we support a network of over 1,300 food bank centres across the UK, providing practical community-led support for people facing hardship. When we're talking about the scale of need that we're seeing. In the first 6 months of this financial year, we gave out 1.3 million, should I say, emergency food parcels provided to people facing hunger in the UK by food banks in our network, with almost 500,000 of those going to children. And this winter, we have seen our busiest winter on record. We're just sort of collating the stats ready to come out in the coming weeks and months. But our estimates were predicting that we would be giving out around one food parcel every 13 seconds over this winter period. And this, when you look at the numbers, you know, we're talking about so in about 2016 to 17, sort of, we gave out 1.2 million emergency food parcels in the whole year, whereas now we're saying within 6 months of the year we've given out 1.3, which just gives a kind of indication of the scale. And most people at food banks come because they don't have enough money, because they're unable to work or they can't get the work. So 3/4 of people at food banks have long-term health problems, maybe mental health issues, or are disabled, or have caring responsibilities, for example, to children or to relatives who aren't well. And 95% of people referred to our food banks would be described as destitute. Now, it's not a word that we would typically sort of use out in our public messaging, but that really means that they are unable to afford the essentials that we all need to keep warm, to keep dry, to be able to eat, to live a basic standard of life. And now, as the cost of living truly takes hold, food banks are telling us about accelerating need, including people from people who are working. So that's something we've seen a rise in, where more and more households are being pushed deeper into poverty. So perhaps pre the pandemic, we wouldn't have seen as many households who had someone working in them, whereas now our latest research, which again is coming out in the coming months, suggests that around 1 in 5 people referred to food banks are in a household where someone is working, and that their wages simply are not enough to cover the cost of essentials anymore. And that shows us again, I think, work is a core part of obviously helping people out of poverty, but it can't be the solution for everyone. And so that's why we as an organisation have a big focus on the social security system. But all of these stories, these data, you know, I could tell you more data around the 40% of people claiming universal credit who are skipping meals to cover essentials. You know, they're very powerful stats, but I think if I wanted to share a story, because I think that's probably a more powerful way of kind of really narrating and understanding what it means to go without the essentials. So I want to tell you a story of a lady called Victoria, who's a 52-year-old mother of 2 who lost her home following a relationship breakdown. And she suffered a heart attack shortly after that, which plunged her family further into financial difficulty and meant that she had to visit one of our food banks. And she told us, this is just a quote, and I thought I'd read it actually because it's really powerful. She said that the health issues caused by my heart attack mean I get disability support. But when you get a letter to say, this is how much we think you need to live on, you think, really? How can they think that? If I don't eat anything, if I don't turn the lights on, if I have a cold shower and don't go anywhere, I can probably do that. Sit in a chair in the dark, not really be a human being. I knew food banks existed, but had never been near one. I had a house, a job, didn't think I would ever need to go to a food bank. The people at the food bank were unbelievable. They treated me without any judgment, but we shouldn't have to go to food banks. That shouldn't be happening. People need proper financial support to live on. I didn't choose to have a heart attack. We didn't choose to be in this situation. Bad ex-husband, bad finance company, having a stroke, having a heart attack, and we're here fighting to get out of it. Now, Victoria's story, like so many people we see here at food banks across the UK, underlines that for us, this need has existed long before the pandemic. I think it's quite easy to blame a lot on the pandemic and the cost of living crisis. And whilst that is absolutely driving the need that we're seeing, extremely low levels of income and the design of our social security system has been a real problem for many years. And therefore, we need long-term change, not just a response to an immediate cost of living crisis. And we believe at Trussell that no one should need to turn to charity for something as essential as food. And whilst our food banks are doing all that they can to be there to support their community, for the first time ever, some food banks are seeing that the donations that they're receiving are not keeping up with the level of need that they're seeing in their community. So they're having to purchase food in large volumes in order to keep up with that level of need. And that's just not right. And it doesn't have to be this way. And so we have a big call and a push with lots of partners in the sector that calling on the UK government to take action to make sure that this doesn't become the new normal, because unfortunately it is becoming increasingly, there's children's books about going to the food bank. I was watching a program, I've got a toddler, with my daughter the other day, and it was just a little children's TV program, and they were talking about food and making meals, and then in it they kind of do a trip to the food bank to sort of donate food. But I was like, how wrong is this, that on a toddler's TV program that there is showing a food bank as a part of normal society? It's not right. And so we believe that long-term change needs to happen. And so we'll do as much as we can, and our volunteers are incredible volunteers, will serve their communities. But that's why we call on the government to make sure that there will be long-term change.
Thank you so much, Danni. It's really confronting. And I think what you were saying about putting the current crisis in context is really important. It struck me that a lot of the issues you were talking about, obviously we know that women are particularly vulnerable to poverty, particularly as they so often find themselves in caregiving roles. And that seemed to be what you were describing. Yeah. That reflect that?
Yeah, absolutely. We see a disproportionate number, I probably find the stats, but a disproportionate number of single parent families who, again, we know are predominantly, not always, but predominantly women. We see disproportionate number of people who are in caregiving roles, whether that's to children or to other family members. So yeah, absolutely. I think we would definitely see those groups overrepresented in our food banks. And I think this is why I think you're right. Taking that step back is really important, because whilst the cost of living is absolutely being driven by, the war in Ukraine, the fuel prices, the pandemic hangover, and all the things that we are seeing, to really take a step back at this and look at it from a holistic perspective, you probably need to start talking about the cost of childcare, the cost of wages, like all of these holistic issues that are meaning that it's no longer sustainable for people to be able to afford the bare essentials.
And you touched on sort of disabled people and people with long-term health conditions. And can you sort of elaborate a little bit more about how you see that as a kind of longer term issue?
Yeah, absolutely. So we're about to do some research on this, because we've recognised that around 62% of people referred to our food banks would describe themselves as having some sort of disability or mental health problem, which again is disproportionate to the number of people in sort of typical statistics would bear out. And so I think it reflects again the kind of long-term underinvestment in support, where the social security system, for one, is not often enough. The additional costs that people, you read the stories in the news, don't you, of people who are unable to keep their heating on that they need because of their health condition and things like that. So I think there's a kind of cost of living element to it, where people with experiencing disabilities or mental health issues are disproportionately affected. But as we know, it's not just about the benefit system. We also know that there's a lack of social support in society and in communities, and that plays a big part. And for us, a lot of when we talk to people who come to food banks, obviously not having enough money is a core part of it, but also not having the support networks around them that they're able to turn to when they have a crisis, because any one of us can face a crisis. We can all have a difficult time. We can lose a job, we can lose a loved one, we can have to fall into ill health, but actually often the people we're seeing come to our food banks don't have those support networks. And I think that's really important as well, to make sure that we're considering that as a factor.
Oh yeah, that's really striking. And I mean, there's so much stigma, isn't there, about finding yourself in this position, even though we're hearing so many people are finding themselves in this position. what are some of kind of barriers that people have in accessing support?
I think exactly as you say, the stigma is the biggest thing. Whereas I think, and do you know what, the cost of living in the pandemic has done something potentially positive, I think, in the public sort of consciousness. And I think there's an opportunity for us to tap into this. Whereas perhaps before the pandemic, there might have been quite a lot of stereotypes around, or if you find yourself in that situation, it's probably because you've made some bad decisions, or almost like you've done something wrong. Whereas now I think, and that's never been the case, but now I think more than ever with the pandemic and the cost of living crisis, what we can see is that, you know, each one of us, like my bills have gone up exponentially, and, you know, everyone is impacted by this. And it's not a sense of, there's no sort of personal responsibility for this. This is often the system and the macro things that are happening around. And so I think that's really, important to kind of keep awareness of that. So I think there is a moment where public perception is changing. And so I think we can use this moment to kind of look at how do we galvanize public support around these issues. We're launching a campaign in partnership with Joseph Rowntree Foundation and other kind of partners across the anti-poverty sector, which is around everyone should be able to afford the essentials. And what we're seeking to win, particularly in the build up to the next general election, is that point of principle that we're not talking about, you know, people having necessarily even the luxuries or the things that you and I might consider just normal part of life. We're talking about people being able to afford to pay for prescriptions. We're talking about people being able to pay for uniform for their children. We're talking about people being able to get the bus to their work. All these basic things that each one of us needs. And so I think there is still a lot of stigma, as you say, in terms of visiting a food bank, but I think public perception is hopefully changing for the better in terms of recognising where the responsibility to address this lies. But I think our food banks do an amazing job. You know, they welcome everyone with a cup of tea, with a biscuit, with a sense of welcome, and we seek to make sure we're culturally appropriate as well, depending on where people's backgrounds might come from, and the food that we provide might be culturally appropriate. So I think there's lots of things that food banks can do and do to make sure that people feel able to access. But at the end of the day, it all comes back to, it's not right that anyone should need to have to.
And as a sort of, you know, how can we maintain this moment where we've acknowledged that actually the personal responsibility isn't the real issue when it comes to people finding themselves in that position. So that's something we need to be able to maintain even once this crisis kind of is no longer in the headlines. It's something that we need to keep.
Absolutely. And I think this is where, you know, we're really calling on the government to really think about these things, because, for example, universal credit, which is the benefit that most people are on when they face a period where they're unable to work for any reason, whether that's a disability, ill health, caring responsibility, unemployment. You know, universal credit is not actually calculated based on the real costs. It's based on kind of an arbitrary figure. And so we're saying, actually, surely as a minimum, that figure should be calculated on what the actual essentials that we all need to live on are. And something as simple as a change in the legislation which says that the universal credit will always be sort of benchmarked at the level to afford the essentials would be transformational. And that's what we're hoping to kind of win and push forward in the coming months and weeks and years, with particularly in the build up to the general election, that commitment to making sure that, as you say, we really take responsibility for this as a long-term solution, rather than it just being a kind of, here's a bit of short-term extra money for cost of living. Whilst that absolutely is welcome, and you know, cost of living support has been great, we can't pretend that, you know, whatever it is that we've capped the bills to now, £3,000 is it for your electricity bills, is affordable. You know, that's triple what it was a year ago. These things are not affordable, and we need long-term solutions to address that.
Thank you. Another question I have, obviously we're an organisation that works with women, but we know that women are not a monolith, and you are also talking about disabled people, long-term sick, single parent families. Are there other demographics that are kind of overrepresented in terms of who you're taking care of in the food banks?
We are again, we've just done a big piece of research called Hunger in the UK, which is looking into this in more detail. But what we do know is people from Black and Asian and minority ethnic communities are disproportionately, in terms of sort of relative to the wider population, represented in our food banks. But again, I think this is reflective of the statistics that we know around the poverty space and the issues that are groups that are disproportionately impacted by poverty are going to be the groups that are disproportionately impacted by needing to use a food bank. And we're really keen to build partnerships and relationships with allies who might not be, and I think you might see some of this in the coming years in some of our work at Trussell, is that we recognise, like I say, that there are groups that are disproportionately represented in our food banks. And so how can we work with organisations that might specialise in supporting people, single parent families, or people with disabilities, or people from the BAME community, whatever that looks like. We want to look at how we can build partnerships so that we can together seek to address the issues that are driving people disproportionately into our food banks.
And it goes back to what you were saying before, those issues aren't new, they're just being shown up in sort of bright highlighted letters by the current situation that we're facing.
Yeah, absolutely.
So kind of as a sort of call to action for us, what can we all do as communities, whether that's faith-based communities, secular communities, women's sector, to challenge stigma around these issues, or to support women in other ways who are accessing these frontline services like food banks?
Yeah, absolutely, great question. I think above all else, I think it's really trying to raise awareness of the support that is out there. So I think one of the things that we see is that some people come to our food banks and have been referred to our food banks before they've necessarily had access to some of the other support that might be available in the community, whether that's kind of income maximization support, debt advice, things like that. And obviously we want to be there for people who are facing a crisis, but I think the more that we can do in our organizations and communities to raise awareness of the support services that are available in an area so that people feel that they know where to turn. Because I've been reflecting on this recently, where it's like, if I was to face a crisis myself, would I know where to turn for support? And so the more that we can do to make sure that people know where they can go for support when they face a hard time, but also, as you say, is to normalize it in our group, in our groups. You know, some of my portfolio of work at Trussell Trust involves overseeing our church engagement work. So how could churches raise awareness? Is it on the notice boards that say, you know, are you facing financial hardship? Do you need to know about this? Or putting it into newsletters, putting it into things that are happening already in spaces where people already gather, people already come, so that it becomes normal to recognize that people do need support, that we all face crises at different points in our lives. And so I think the more that we can be aware of the support that's available, raise awareness of it, but also normalize people asking for help when they need it, that there isn't a shame, that there isn't something that you know, it's not there's not a personal responsibility, actually, that there are things that are driving, there are systemic issues that are driving people to need to use a food bank. The more that we can raise that awareness in our communities, the better.
And I think, you know, in that story you shared, the kind of dehumanizing impact for that individual on what her experience of poverty was like. It's about bringing the humanity back into the conversation.
Definitely.
Yeah.
And that's exactly it. So our food banks, one of the things that we found the hardest in the pandemic was that, so our food banks historically, whilst they give out a food parcel, they have someone's referred to them, they get a food parcel. The biggest thing that we always had embedded was that someone would come in, they'd have a cup of tea, they'd maybe have a slice of cake, they'd be able to sit down, chat to someone, just to say, how's it going? Like, how can we help you? We're here to listen. But during the pandemic, because of all the restrictions, a lot of our food banks either had to go to a delivery model where they dropped food off at people's front doors, or it was literally like queuing outside and handing over a food parcel at the door. And that really lost something of that kind of humanity that we really have always sought. So our values are about dignity, about compassion. And for us, like, that cup of tea for me is the embodiment of that dignity. It's going, look, I don't care what you've been through, where you are, what's going on, just come, have a cup of tea, sit down and be welcomed. And that is what our food banks are increasingly able to do now that all the restrictions and things like that have been lifting over the last few years, and as they've kind of got their processes back up. But yeah, that is remembering that people are people is the key thing.
Thank you, Danni, so much for your time. So many things to take away there and kind of think about a bit more, but thank you so much.
No, thanks, Maeve. It's been great to chat.
Hello, my name is Ignacia Pinto. I'm Research and Policy Officer at the Women's Budget Group. And today I'm going to talk a bit about the cost of living crisis and the impact on women. So I think it's important to have a context and understand like where are we coming from to face this crisis. So first, we are here after more than a decade of austerity, and that means an erosion of social security during the last 12 years. Also, we are facing stagnant incomes, and that means that real wages, like the real value of salaries, has been decreasing. So with the same amount of money, we're able to buy less things. And of course, the COVID pandemic put more pressure on households that were already struggling. And this exacerbated pre-existing inequalities, and the impact has been even worse for women, young people, Black, Asian, and minority ethnic communities, disabled people, and those on low incomes. And at the Women's Budget Group, we also say that the cost of living crisis is a gender crisis. It has a gender aspect. Why? Because women are more likely to live in poverty because they have low levels of savings and higher levels of debt, so they are less prepared to face this increase in prices. Also, women have caring responsibilities. This means that they are less able to increase, for example, their working hours, to increase their income. That's not an option because childcare is so expensive or unavailable, and the same with social care. And also women, are the main workforce in public services, in the health sector, for example, and also they are more reliable on that. They rely more on public services. So any cuts to public services means that women, will have like this support that they have is diminished, and also their incomes are going down. And like a bottom line, and the final thing that I would like to say to start is that women are generally the shock absorbers of poverty. Why? Because within families, women are more likely to oversee the household budget and more likely to cut food, heating, or clothing for themselves, to provide for children and other household members. And also, as I said, cuts in public services are generally replaced by women's unpaid labor. So if there's no care publicly provided, women are the one that will probably provide that care with their unpaid labor. So women are the providers of last resort. And of course, that leaves them in a worse position to face the cost of living crisis. So yeah, that's my presentation, and yeah, I would like to discuss questions and comments.
Thank you so much, Ignacia. That was fascinating. It really does highlight how vulnerable women are in situations like the one we're in at the moment. I was interested in what you said about young people being vulnerable at times like these. Is that something we also see for young women in particular? Are there generational differences there when it comes to women's vulnerabilities?
I think that we're seeing that for young people, it's being more difficult to get into the workforce, or wages are really low in comparison with the cost of like paying a rent or going even to the shops and get some basic groceries. So in that sense, are more vulnerable. And also, for example, for single women, it's very difficult to afford rent privately. And yeah, I mean, if for a single young mother, it's not possible to pay for childcare and a private rent, because those things are more than half of the median salary. So it's like really unaffordable to either pay rent. You would have to choose, right? Either childcare or paying the rent. And let's not even talk about heating or buying essentials. So yeah, that's, for example, that's an example of how young women would be more affected by this.
Right, so that's really clear. And is that also, I mean, in times like this, when people are having issues with heating, we hear a lot about older adults being particularly vulnerable. Is there similar statistics for older women?
Yes, because women, as they generally have lower wages than their pension, it's low. It's lower than in comparison with men. But what we have seen, for example, the rates of poverty, they have been improving in terms that there are less elderly people in poverty because pensions are being kind of protected. It's not the same case for children. So I think lone mothers and their children, it's a much more vulnerable group than the elderly.
And it's fascinating that that isn't being covered in the same way when we're having public conversations about the cost of living. We hear a lot about sort of economic abuse leaving women particularly vulnerable, especially during periods of national economic downturn. Is this something you've seen as well with women?
Yes, so last year we worked on a report on the cost of living crisis, and we saw some numbers from Women's Aid saying that women were declaring that abusers are using the cost of living crisis as a way to keep them like in their homes without the possibility of leaving that situation of violence. So yeah, that's something that has been reported by organizations that work directly with women victims of domestic violence.
Given that the gendered impact of the cost of living crisis is underreported, I know you mentioned disabled communities, minoritized communities from an ethnic perspective as well. Are some communities of women experiencing particular hardship as a result of this impact and also of the underreporting of the gender impact? Does that underreporting in itself impact women?
I think that like this underreporting has a final impact in public policies, because if everyone were like aware of the gender difference, then the public response would have like a gender component. For example, there has been some support for households, the energy price warranty. But what happens with bigger families? So we have a flat payment for each household, but larger families with more children, at the end, the support for them, it's less than for a person that a household with just one person. So I think that this underreporting it's like a loop. Yeah. It just makes the problem worse.
And you touched on policy there. What can we all do as kind of communities, whether that's faith-based organizations like ourselves or kind of the broader secular community? How can we kind of challenge this stigma around financial struggles, but also around talking about this issue of the gender crisis that you're describing in the economic situation we have at the moment? I
think that something like that might sound like very basic, but is very important, is awareness. Because some policies they are not, it's like the same policy for men and women. So you would say, no, it's like gender equal because we won't make any difference between men and women. But that point, or that way to approach policy, it's results in a difference. So I think something like very important that could be done at the community level is, as I said, be aware of who is in charge of buying food, generally women. So who are the ones even like being more stressed about how they are going to provide for their children? Women. Who are the ones cutting on heating for themselves? Women. So just even being aware of that difference, I think it would be a very important step, because then solutions that we're going to provide, if we are aware of that difference, I hope that will be like gender responsive, as we said, like with a gender aspect. But you only can do that if you know that there's a real difference for women and men when facing the cost of living crisis.
Thank you so much, Ignacia. It's really important to keep this conversation going then, and there's definitely a call to action in there for all of us. So thank you so much. Really, really important to hear your insight. A huge thank you to both of our speakers for giving their time to talk about this crisis that is so much at the forefront of all our minds, and shining a light on this gendered dimension and the structural issues behind it that we so often overlook. We'll be linking to both the Trussell Trust and the Women's Budget Group in the bio of this video, so please do support, get involved, follow up where you can. I hope we've all come away feeling energized to support the women in our communities who are struggling now more than ever, and to keep this conversation about financial inequality going. Thank you.